Our next guest settling into his seat. We met him recently, and he's back because of some interesting information along the lines of mammograms for women and some new information and recommendations along those lines. Dr. James Cesare is here from Slocum-Dickson. Doctor, welcome back to the show. How are you?
Thank you very much.
Good morning.
Glad to be here.
Yes.
Good morning.
Yeah, so this news just broke, actually, where now the recommendations are 45 years old for women getting mammograms. And what are the reasons behind that?
Well, the new guidelines that they've come up with, many of us do not really agree with. Just to start it all off.
Interesting.
See that?
You know, if I could put it in perspective, the guidelines that have been in place for over 2 decades from the American Cancer Society have been early self-examination in their 20s, clinical or doctor examinations in their 30s, and yearly mammograms after the age of 40. The new guidelines are telling us from 45 years old to 55, you can have a mammogram once a year, and then after the age of 55, every other year, and they advocate no clinical breast examinations.
Now, what would be their motivation for doing this?
Well, the motivation behind this is really not that clear. If you looked at what was said by the director, they were not sure that mammograms helped prevent cancer death. Well, we know from the old guidelines, historically, 38% decrease in death rate in women with early detection,
right,
early diagnosis, and early treatment. And that's been working. That's created a great impact for women and saving lives. So for these new guidelines, I don't understand how they can think that that would not increase the death rate and cause more women to have greater pain and anxiety, because that's what they claimed not doing mammograms would keep women from having pain and anxiety.
Right, and it was interesting that you said about the clinical, tests, and when you go into the doctor's office as a female, you get checked, especially when you're over the age of 30, and they ask you if you do your self-exams. But a lot of women, and my sister's a nurse, and she says, a lot of women don't really do the self-exam properly. So it's interesting that they're saying that, he doesn't need to have a clinical exam every year when you're, especially at the age of 30. I find that kind of interesting.
Well, I'll tell you, most of the women, first of all, we have many women in their 20s and 30s
right,
and early 40s with breast cancer. It's not rare. It is. We see this a lot, and we have many women in our practice. Most women claim they do not do a proper self-examination. But there was a great Harvard study that said you really don't have to do the 6 steps with your arm over your head and go in circles. Very difficult to do. I tell my patients, just feel your breast.
Right.
Once a month, beginning of the month, in the shower, in bed, putting on lotion. Just touch the breast and feel it, because most women will actually feel an abnormality.
And you were saying, a lot of women are diagnosed very young. I have friends of mine who were diagnosed at the age of 29 and 30. Some of them, one woman, she doesn't know if she has a history of it in her family because she's adopted. And then she was diagnosed when she had her 3rd child. So, what is this going to mean especially for women who do have a history or don't know their family history?
Well, for women that do have a family history or are at high risk or elevated risk, the American Cancer Society is not saying to change the normal routine of getting mammograms early and yearly examinations. They're really claiming for the average risk woman to adopt these new guidelines. But for women that are at elevated risk, they need to come earlier. Usually I start 10 years earlier than the norm for women that are elevated risk because we do find cancers that run in the family. Genetic testing now has identified women that are at much earlier risk and need treatment earlier, like the Angelina Jolie type patients.
Sure.
And I have one other question. What is this going to do for, insurance? Because insurance usually goes off of what the norm is and what recommendations are from societies like the Cancer Association. What does this mean for insurance? Because I know a lot of women who even do have a history have a very hard time getting mammograms covered. That's why the clinics do free ones and everything like that, and that's why they're out there, but they can't get them covered. So what is this going to do for women who need to get a mammogram earlier on in life?
Well, it is hard for us not to believe that these new guidelines are driven by more socialized type of medicine protocols, new health care that we're seeing, this Obamacare, driven by those by that impetus. They're trying to do less testing, less mammograms, and you have to believe, you can't help but think this is to save money. Right. And insurance companies will fall right in with this because the less testing they have to cover, the better it is for them. And it seems more a money issue than a health issue for women, because women need mammograms. This has been proven for so many years. You know, the statistics show it, 38% decrease in death rate. The only cancer that the death rate is decreasing out of all cancers. Why? Because early examination, early detection, early diagnosis, and early treatment. Yes, the treatments are better.
Right.
And we are doing a much better job, but you need to find it early. Who wants to find it at stage 3 or stage 4?
Talking to Dr. James Cesare, the Breast Care Center at Slocum-Dickson here on the Talk of the Town, 100.7 FM WUTQ, and talking about the relaxation of the guidelines and the suggestions for mammograms for women. At the same time, there was news this week about more stringent guidelines being recommended for colon cancer screenings among people. They were dropping the age for that, I thought. It's kind of ironic at the same time.
It is very ironic, and if you even think of skin cancer, which is the most prevalent cancer and killer, melanoma, you know, kills more Americans per people diagnosed than any other cancer. Those rates, just compare biopsy rates. The rates of detecting melanoma with biopsy on skin lesions is about 3%. The actual biopsy rate of positive findings in breast cancer biopsies is about 15 to 20%. So it's better with breast cancer than with skin cancer.
Right.
Colon cancer is the same way, yet guidelines are trying to tighten up with other cancers. Yeah. It just doesn't seem to make sense.
Right.
And you mentioned that you're seeing this more in a younger age for women. In your determination and what you've seen, can you give us a median age of when this really starts to show up?
Well, we know that breast cancer is sort of exponential. So in your 20s and 30s, the incidence is very low, and it increases with a peak somewhere between 45 and 55 or 60. And then the ironic thing is it doesn't fall off. You know, if you reach the age of 70, most women think, oh, I'm free and clear. I never had breast cancer. But actually, the incidence does not fall. It actually stays pretty level throughout your life.
That's interesting. You mentioned 45 as being maybe one of the higher cases in the age group, and you know they're telling us now, you know, as Sam and we mentioned, that 5 years later is the time to start getting detection. What would be the repercussions? What could happen in that 5-year gap between 40 and 45?
Well, you know, in that time period, I'll just give you an example. I had a patient who was 40 years old,
right,
who comes every year. You know, I see her, and within 6 months of our last visit and mammogram, she developed a 3-centimeter tumor in her breast. It happens. You know, breast cancer doesn't behave in a normal fashion.
Right.
You know, it can stay latent, which means it can grow slowly and then all of a sudden appear and sometimes grow rapidly. So to not have women doing self-examinations or being screened or being seen by a doctor, I find that very, very backwards. We're going backwards if we do this.
Really instrumental. And, you know, a question that I had on my notes, and I know that it's becoming more and more prevalent, but women that have breast implants, do they need greater detection? Do they need earlier detection? Is there any other steps they need to take?
Well, women with implants, it's interesting. You know, before we would think they're very hard. If you get implants, it's very hard to detect breast cancers. But with today's technology, with digital mammogram, which we use, and now new 3D, which is just a little bit better mammogram, breast implants make no difference. You can still see the breast very well. You can screen. Maybe a little more difficult to detect by palpation, but I've had women come in with implants and say, I have a lump, and it's small, and they feel it.
Right, because you know.
Well, interesting talking medicine with Dr. James Cesare from Slocum-Dickson. We had an interesting story earlier in the week about a woman in Scotland who apparently can smell Parkinson's disease. I was fascinated by that. Apparently, it's proven that she smelled it, some odd smell on her husband, and then they tested it against somebody else who had the disease. She was able to identify it among other people in the study too. Medicine always fascinates me.
Well, the new guidelines say she can't smell anybody till they're 60.
You didn't learn that in medical school, did you?
Any big plans for the weekend, Doctor? What do you got going on?
Well, we're having a little Rocktoberfest coming up, so
Nice.
we're going to get dressed up and do our thing.
Great. Best of luck, and thanks for coming in, providing some information, shedding some light.